what would you promote in terms of improving the role of telehealth, not just for emergency cases like yours, but in general, in
Yeah.
terms of payment, I'm talking about in regulations.
Yeah, I think that so there are while all of this was going on and the licensure waivers were expiring and the parity laws were changing and whatnot, one of the things that I did hear about the limitations that they had was limits on, for instance, on audio only, except for behavioral health. Like that made sense. You know, there are limitations. Those parities, the parity laws were changing, and I know with the pandemic, they kind of lifted the restriction and said,
Right,
fine, audio only is fine, or whatever. And now it's going back. So I would say, to answer your question, I would say I would look at the limitations of telemedicine and understand the limitations because you want to have a value prop, but also you want to really have the ability to increase the scope of telemedicine where it's needed the most and where it makes sense the most. So for emergencies, and it's not just neurologic
right,
emergencies,
right,
uh, for all kinds of emergencies that really are short in specialists, and you really need a specialist. Um, you really should open this up, and also for outpatient follow-ups where we really lack the specialists that really need
right,
to have that. Neurologic care is unique in that it's really not something that primary care physicians can handle
right,
or see patients afterwards or whatnot. So we really need to look at specific use cases in the world of specialists where outpatient specialty care makes sense to keep people healthy, keep people out of the hospital, get the cost down. If I am providing outpatient specialty care and that's paid for, that payment model is so much less than if that patient doesn't get to be seen for months and then they go back in with another stroke. And that gives disability. And again, a lot of the dollars are always have to do with morbidity and mortality and the last couple of years of life. So when you're looking at how to save money, for our budgets, really it really is focused on giving better care. And part of that is having, the right parity laws and the right infrastructure for payments for that continuum of care, not just focus on the hyper emergencies. That's the short answer to that.